Welcome back to my channel. Today I'm going to be explaining everything you need to know about uterine fibroid. Uterine fibroid is one challenge that most women have to go through once in a lifetime, most times recurrently. So today I'm going to be giving you all the information about uterine fibroid, how to manage yourself, and the best way to get your treatment if you're diagnosed with uterine fibroid. My name is Chinelo Ezimoha. I am a nurse midwife, and today I'm going to be simplifying everything you need to know about uterine fibroid. Do well to subscribe to my channel, share to your friends, and let's get into it. Uterine fibroids are abnormal growths in the uterus or on the uterus. Either they grow inside the uterus or they grow outside the uterus. These are uterine fibroids, and these fibroids are non-cancerous. They are benign. That is, the growth is not cancerous. So they can develop at any point or any part of the uterus, and that is where the fibroid begins to develop. So the fibroid can either be small or they can be large. Some women present with severe symptoms when these fibroids occur. Some may live all their life having this fibroid, but they may not present with any symptom. So uterine fibroid can happen to 20 to 80% of women before the age of 50. And some will usually have it, but they will not even know because there will not be any presentation of uterine fibroid. So uterine fibroid can come in different names, but they all mean the same thing. It may be diagnosed as fibromas, uterine fibroid, myomas, leiomyomas, or fibromyomas. It comes in different names, but they all mean the same thing. So uterine fibroid can occur in different parts of the uterus. So your understanding of the exact point where it is will also know the kind of treatment that will be given to that particular one. So first, it can be intramural. Intramural means it's developing at the muscular layer of the uterus. It can come in large quantity and also smaller quantity and make the uterus to look bigger in size. The second one is the subserosal. The subserosal uterine fibroid grows outside the uterus. In this case, the subserosal uterine fibroid, what it does is it makes the uterus to be big. And this one is more common and more severe because it comes with a lot of heavy vaginal bleeding, especially during menstrual period. That is what the subserosal does. Then we have the pedunculated uterine fibroid. This one, the fibroid grows a stem that holds the subserosa in place, thereby enlarging the uterus. We also have the submucosa. Submucosa occurs in the middle layer of the uterus. This one is very rare. Is not common like the other ones. They also have the cervical uterine fibroid. This one is the fibroid grows in the cervix. This one also is also rare. So uterine fibroid can come with a lot of symptoms, but the most presenting symptoms that will make someone to suspect if this person may be presenting with uterine fibroid or there may be an abnormal growth in the uterus is when this person start having heavy bleeding during menstruation or in between menstruation, and these menstruations can come with clots, thick clots as they are menstruating. The menstruation can last longer than normal. Normal menstruation can be between 3 to 5 days, but this person may bleed up to 7 to 10 days. That is a sign that there's an abnormal growth. And also, there is increase in menstrual cramp. Normally, menstrual cramps do occur during menstruation, but when there is fibroid, when in the case of fibroid, the menstrual cramp comes more, the cramps becomes more severe, and there is a lot of pain, especially at the lower abdomen. There's a lot of pelvic pain and lower back pain. So all these things are signs that this person should go for a test to check if there is any sign of uterine fibroid. Now, what are the causes of this uterine fibroid? What could be the cause? What could make somebody develop fibroid? The causes sometimes are idiopathic, which means we cannot tell exactly where these causes are coming from. But there are some predisposing factors that will predispose a woman to uterine fibroid. The first one is hormones. During after menstruation, estrogen and progesterone are secreted to help the walls of the uterus to regenerate. Now, in the process of that regeneration, it can cause or stimulate the growth of fibroid. So estrogen and progesterone can also predispose a woman to uterine fibroid. Another cause could be, it could be genetic, could be in the family. Probably the mother, the sister, or the grandmother of someone, if they come down with fibroid, there's possibility that the person may also have uterine fibroid. The another cause may be cyst, especially ovarian cyst. As this cyst begins to enlarge, it can lead to development of abnormal growth in the uterus. Another one is pregnancy. You know, when a woman is pregnant and the increased production of progesterone can stimulate the growth of fibroid in the uterus. That is why some women are pregnant and they also have fibroid. So pregnancy can predispose it. Then another one is women that are above 30. Women from 30 years and above can develop it. Then we also have women that are overweight, women that are big, have heavy, larger weight in size. They can also develop it. Then black women, black Americans, all these things are predisposing factors to uterine fibroid. Now, how is it diagnosed? How do you know? Apart from the signs and symptoms that are presented, what and what will you know? How will you diagnose uterine fibroid? So, if you start having these signs and symptoms, the first thing to do is to go see a gynecologist. Your gynecologist will now tell you the tests to do to diagnose properly that this thing is fibroid, know the type of fibroid, and know the position and the location of this fibroid. Now, the first test you will do is a pelvic exam. You do a pelvic exam to know the condition, to know the size and the shape of your uterus, to know if there's any abnormality or any enlargement in the shape and size of the uterus. The next one is an ultrasound. This is where the inner structures of the uterus is displayed on a screen, and if there's any growth, it will be seen. Another one is transvaginal ultrasound. This one is an ultrasound wand will be inserted through the vagina, and this wand will visualize the inner structures of the uterus to see if there's any abnormal. And another one is pelvic MRI. This is in-depth test where all the structures, the uterus, the ovaries, and all the organs around the pelvis, the uterus, the pelvis, and the fallopian, the ovaries will be visualized, and everything, all the structures will be seen. How is fibroid treated? Fibroid can be treated depending on the size, the location, and the condition. That is why it is advised for every woman who is diagnosed with fibroid to work hand in hand with a gynecologist, and this is the best way to manage it. It can be treated with medications as prescribed by your doctor. It can also be treated with surgery, depending on the size, depending on the location and the condition of the fibroid. Remember, it's not every fibroid that is operated on. It's not every fibroid that can be treated. Some can just be left to develop, then they only observe it for a while or for some time before they can take any action. So it all depends. It is holistic. It all depends on the condition the woman presents, and that is where the line of treatment will follow. So if you're someone that already has this fibroid, how are you going to help yourself? First of all, you have to have good physical activity. You have to exercise, do yoga. Make sure that your weight is within the normal range. You can go for massage. Then when there is abdominal pain, because it is associated with a lot of abdominal pain, especially when the growth is getting bigger and bigger. So when this thing occur, you can apply heat in your abdomen. But if you have excessive bleeding, if there is record of excessive bleeding, you should avoid heat. Avoid applying heat in your abdomen. Another way to manage yourself effectively when you're diagnosed with fibroid is your diet modification. You have to modify what you eat. You have to eat more of green leafy vegetables. Eat more of vegetables. Reduce or totally avoid refined meat. refined meat, red meat, cow meat, refined meat, you avoid it. You avoid carbonated food, you avoid sugary foods, you limit your intake of alcohol. Very important. You limit your intake of alcohol, you limit your intake of salt, you exercise regularly, and you try as much as possible to reduce stress. You see, this condition is something that can be well handled. So you should not allow stress or thinking about the outcome to make you lose the focus of the treatment, because this thing is attached with a lot of emotional stress, and most women may not handle it well. And the more you put your body, the more you stress yourself or the more you worry yourself about it, the more the thing will continue to happen. But if you can just be goal oriented and focus on things that will help you instead of things that will make it worse, I think that is the best option. So I know I'll be able to explain everything you need to know about uterine fibroid. Remember, always work hand in hand with your gynecologist, because this is the best way to go about it. And if you already have fibroid and you're trying to get pregnant, talk to your doctor about it. It is very, very possible to be pregnant and still have fibroid. It is very possible. So just for you to know yourself, know your body, know how your body works, and work together with your healthcare provider. Do well to subscribe to my channel, turn on your notification button so that anytime I post a video, you'll be the first to see it. And also share this video to your friends and family, and ask any question in the comment section if you feel if there's anything that is confusing to you. Bye for now.